Thank you for joining Cancer Support Community Atlanta for Lymphedema, Who's at Risk and What You Can Do, facilitated by Megan Stevens with Northside Hospital Rehabilitation Services and moderated by Tammy Malone with A Wellness Place. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. If this is your first time participating, we invite you to complete a new attendee form to stay connected to all future programs. Welcome everyone to today's program, Lymphedema, Who's at Risk and What You Can Do. I'm Katie Armsby, the Program Outreach Director with Cancer Support Community Atlanta. If this is your first time participating in a Cancer Support Community Atlanta program, we welcome you and invite you to visit our website, cscatlanta.org, where you can see a complete list of the virtual oncology programs offered. These include virtual support groups led by licensed mental health professionals, stress reduction classes like yoga and Tai Chi, a monthly nutrition seminar facilitated by an oncology dietitian with Northside Hospital Cancer Institute, and education programs like these. And if you ever miss a live event, we invite you to visit the video tab of our website where you can find recordings of past programs. Again, that's cscatlanta.org. As a reminder, everyone will remain on mute for the duration of today's program. We do invite you to enter questions into the program chat box, which will be addressed during the Q&A at the end of the program, time permitting. I'm excited to welcome today's program moderator, Tammy Malone. Tammy Malone's interest in lymphedema and compression garments began in 1970 when her mother's journey with lymphedema started following cancer surgery. She began her career working for a compression company as a seamstress and sewing custom-made compression garments for individual patients. She was promoted to the research department where she began designing and engineering compression garments. Tammy relocated to Atlanta in 1985 and began a career measuring and fitting patients for the compression garments that she used to design and sew. Tammy started working with Northside Hospital in 2005 and currently works with A Wellness Place, fitting patients with compression garments. She feels it's a true joy to be able to take part in each person's successful outcome after fitting them with the appropriate product. So with that, welcome Tammy, and I will pass it off to you to begin today's presentation.
Yes, hi. Megan Stevens is an occupational therapist with Northside Hospital's outpatient rehabilitation services at the Alpharetta campus. She graduated with her undergraduate degree in exercise and health science from Kennesaw State University and her master's in occupational therapy from Augusta University, formerly Medical College of Georgia. She has worked in a variety of settings, including neuro-rehabilitation, orthopedic rehabilitation, and oncology rehabilitation, and has a certification in management of lymphedema. Megan was born and raised in Marietta, Georgia, and now lives in Alpharetta with her husband, Patrick, 5-month-old son, Ellie, and dog, Sunny. In her free time, she enjoys traveling, reading, painting, and outdoor exercise. So we're going to give this over to Megan and she's going to present.
Thank you, Tammy. Thank you, Tammy. So like she said, my name is Megan. I am an occupational therapist with Northside Hospital's outpatient rehab services. Today, we're going to be talking about lymphedema, who is at risk, and what you can do about it. So we'll start off with what is lymphedema. Lymphedema is swelling that is caused by a buildup of protein-rich fluid as a result of damage or overflow to the lymphatic system. So there are 3 big questions people ask often when in regards to lymphedema. How do you get lymphedema? Why do you get lymphedema? And who is at risk for getting lymphedema? So we're going to start with the how. The easiest way to start with the how is to have just a little bit of an idea of what the role or the function of the lymphatic system is. Look at just a little bit of basic anatomy, and then talk about what then happens when it's been damaged. So the primary functions of the lymphatic system, my little Spark Notes version, is the garbage disposal, the recycling system, and the alarm system. So it's a garbage disposal in that it removes cellular debris, bacteria, and waste products from the tissues via your circulatory system. It's a recycling system in that it recycles proteins and fluids from the tissues back into the bloodstream. And it's an alarm system in that it alerts or initiates your immune response. Your lymphatic vessels are what carry large and overflow molecules or proteins and bacteria and other debris to be broken down and recirculated back into your bloodstream. Got a couple pictures here just of kind of what that lymphatic system looks like. You've got this whole body image that shows some of the organs that are associated with your lymphatic system, what some of those vessels look like that I was just referencing, as well as the lymph nodes, which is something that some or many of you may have heard of before. The picture to the right shows how those lymph vessels connect back to the circulatory system, where they uptake some of those proteins and then where they put things back into the system. Lymph nodes contain specialized cells to fight infection and help break down that debris. So you have your fluid that comes through these vessels into the lymph node and then back out the node after they've been broken down inside that structure. So how does lymphedema occur? Lymphedema occurs when there is damage, destruction, or disruption to part or all of your lymphatic system. Why does this occur? There are a number of things that can contribute to the development of lymphedema. There are two types, primary and secondary. I'm going to talk about both a little bit, but secondary is what our presentation will primarily be focusing on. Primary lymphedema is congenital. It's seen at birth, often related to a genetic link or some kind of family history. And that is a result of an impairment in the development of the lymphatic system. So that happens early in life. Secondary lymphedema occurs when there has been disruption or destruction due to an outside factor or a cause other than genetics that impairs that system. So that is where we are going next. There are a number of causes that can lead to secondary lymphedema. Trauma and injury is one. If you have a bad injury, it can disrupt your lymphatic system. If you have surgery, that could be considered a trauma that would impact your lymphatic system. Specifically with the oncology population, surgical removal of lymph nodes is a huge one that can contribute to putting someone at higher risk for developing lymphedema. It can be exacerbated by radiation. That also kind of falls under that trauma category. Malignancies, so tumors that grow into the lymphatic system or press upon the lymphatic system, can cause a disruption. Infections can disrupt the lymphatic system by overwhelming or overflowing the system. It can be self-induced if somebody hurts themselves in a manner to cause lymphedema. You don't see that very much in the United States. It's something that is more common outside of the US. Vascular problems, because of the link between the lymphatic system and the circulatory system, when one doesn't operate well, it can impact the other. Immobility, moving helps your lymphatic flow in that your muscles, when they pump against your lymphatic system and help encourage that flow of fluid. So when someone is immobile for extended periods of time, it limits the lymphatic's ability to pump as it should. Renal insufficiency, because your kidneys are responsible for helping with your fluid regulation in your body. So if your kidneys are not working properly, you're not going to have proper fluid regulation. And obesity, which is partially tied to lack of movement, but also related to fat cells releasing a chemical that can damage the lymphatic system. So being overweight or obese can also compromise the lymphatic system in that way. So who is at risk? There isn't a whole lot of clear-cut evidence on why one person who had the exact same 2 lymph nodes removed as somebody else will develop it when this other person does not. It's kind of a mystery, but there are some things that you can do if you know you've had compromise to your lymphatic system in order to reduce the risk of developing lymphedema. So weight management, which I touched on a little bit with a healthy diet and exercise, is a huge one because you avoid that kind of fat cell destruction process that moves or that can impact that lymphatic system, as well as the exercise having that muscle pumping action on your lymphatic system to help encourage lymph flow. Skincare to avoid infections. Again, I had mentioned how infections can overwhelm your lymphatic system, create kind of a traffic jam, for lack of a better analogy. Making sure to avoid things such as sunburn, insect bites, scratches, really any tear to that superficial level of your skin to avoid opportunity for infection to impact your system. Avoiding overheating or overexertion, avoiding excessively tight-fitting clothing, and avoiding extreme temperature or extreme pressure changes whenever possible. So swelling is the most obvious sign or symptom that lymphedema may be developing. However, there are a handful of other signs or symptoms that lymphedema may be developing. Heaviness or tightness in a specific part of your body, limited range of motion. For example, if you had some lymph nodes removed from your underarm and you're all of a sudden having a really hard time reaching into a cabinet to pull dishes out or hanging your clothes up in the closet, and that wasn't a problem before, that tightness could be related. Aching, discomfort, recurring infections, again, because that lymphatic system helps to clear the infectious substances out of your system, and then hardening and thickening of the skin. Typically, the hardening and thickening would happen after the swelling, but all things to look out for if you suspect you may be developing lymphedema. So why do we treat lymphedema? The condition can worsen without treatment. Oftentimes it starts out very mild and people think, oh, I don't know what this is or what to do about it. But the sooner that you start the treatment, the better off you're going to be. So not letting it sit and get worse is going to lead to better outcomes. So we definitely want to treat it as soon as possible. So don't let it get worse if you have the option to try and make it get better. It can lead to infection or cellulitis, which is a very dangerous infection. Again, because you're overwhelming the system, we don't want to perpetuate that cycle. It can be painful, it can be uncomfortable, it can impair your ability to move. I gave the example of reaching up in cabinets, but if you have lymphedema in your legs, it can impact your ability to walk comfortably or safely. It can impact the way that your clothes fit. It can have an emotional consequence, one, because it can make people feel like they don't have control over the situation, but also with the cosmetic aspect of it, people can feel insecure about the way that it looks. So there are a lot of different factors that come into play on why someone would want to get this condition treated. So what can I do about it? If you notice that you're starting to have signs and symptoms of lymphedema, what can you do? Skilled therapy services. So occupational therapists or physical therapists can specialize in lymphedema management. The treatment services are performed by a certified lymphedema therapist. Treatments can include a handful of different things. These are kind of the primary things that we focus on in a session. Manual lymphatic drainage, which is a special type of massage that helps to encourage the flow of the fluid. So not necessarily pushing the fluid out, but encouraging the fluid to move on its own through its pathways. When a node or a vessel has been damaged or disrupted, the manual lymphatic drainage helps to reroute that fluid to find a new path so that it can be cleared by your system. Compression wrapping is kind of the gold standard number one thing we want to do to help with lymphedema reduction. So after we do some manual lymphatic drainage, your therapist will put some sort of compression wrap on you with bandages that are similar in appearance to an ACE bandage, but different in the way that they are made. So an ACE bandage, when you stretch it, stretches and stretches and stretches and stretches. We use what's called short stretch bandages. When you pull, there's a little more tension, a harder end feel on them. We use those to create a wall for your muscle to pump against to get the rebound to help pump that lymphatic system and get that fluid moving again. So with both the drainage and the compression wrapping, our goal is to encourage flow of the fluid through the system through a pathway that is functioning properly. Once we get you in a wrap, we will likely give you some sort of decongestive exercise. Again, once you're in that wrap, we want that muscle pumping. So we'll give you exercises that help to encourage that muscle pump with the wrap on to help get that fluid moving back through the system. Compression pumps are another modality that may be used in session. It is an external pump that, again, facilitates the movement of the fluid through the system. Skincare, hygiene, and infection prevention are a huge part of the education that we do if you come in for therapy services. Again, to make sure that you are not giving opportunity for infection to break that superficial barrier of your skin and risk further compromise of your lymphatic system. And then we take all of those components to develop a customized home program for each of our patients so that long-term they can manage their lymphedema comfortably at home without needing us there the whole time. After you do your formal treatment, then we would send you to a wellness place or another fitter to get custom compression garments. So there are a couple different kinds of garments you can get. There are off-the-shelf garments, which are pre-made in a variety of sizes that you would get fitted for, or custom made, which you would get measured for and then are made specifically for your body. And that is a case-by-case basis depending on what the patient's needs are. And the therapist and the fitter work together to come up with the best solution for a patient so that they can manage their lymphedema long-term. So I have a few pictures here of some things that you might see in treatment. This is a picture of a pretty extreme case of lymphedema in a right arm. This is the compression wrapping I was talking about with the bandages. And because this person had swelling all the way to their fingers, they were wrapped from their finger all the way to their shoulder. But just depending on how a patient's lymphedema presents, it may be more or less than that. Not everyone's wrap will necessarily look just like that. This is a picture of a leg wrap, and you can see it looks a little bit different than the arm wrap. It's a little less bulky and got a few less layers, which likely is because the severity of the swelling is not so significant as in that first picture. And then I included a picture of what a home exercise program might look like. We typically start with pretty basic exercises just to get those muscles moving, and then tailor them based on what the patient's needs and goals are. So there are a few contraindications to lymphedema treatment. Having an acute infection that is not being managed. Congestive heart failure, again, that is not managed. Typically, if somebody is in congestive heart failure, then we as the therapist would need to know that so that we can communicate with your cardiologist and determine if you are an appropriate candidate for treatment. The risk there is that we don't want to overwhelm your circulatory system when your heart is already having a hard time. So it's not that you can't have treatment, but it's that we need special clearance from the physician to make sure that you will be safe in the treatment. Kidney malfunction, kind of similar to the heart failure in that we would have to get clearance from a physician to make sure that your kidneys are functioning enough to process that extra fluid that we are pushing back into the system. And then untreated malignancies. So if you have an active cancer that is not being treated and you have not chosen palliative care, we would want to hold off until you are either being treated or choosing palliative care. We also won't treat swelling that is of no known cause. So if you don't have a reason for what is causing the swelling, until we get down to what that cause is, we're going to want to hold off, because if it is an infection that's causing the swelling, or if it is heart failure that's undiagnosed that's causing swelling, we want to make sure those needs get met first. So what to do if you think you have lymphedema? You want to ask your provider, your physician, for a referral for lymphedema therapy and for garment fitting. So that can be your primary care physician, it could be your oncologist, it could be a cardiologist, whichever physician I would say is most managing your care and would be familiar with what's going on is going to be your best case provider to write your referral. So our lymphedema program at Northside Hospital, I mentioned this already, but is customized to fit each individual based on their needs. The frequency varies. Typically it is 2 to 4 times a week, but really depends case by case on the severity, on what is going to fit in with the patient's schedule, really what the needs of the patient are. So that is custom tailored to what your needs are. The duration of the treatment depends on progress and the patient's specific needs. So somebody might come for a few weeks and then be appropriate for a custom garment. Somebody might come for a few months before they're appropriate for a custom garment. It really just depends on how quickly they respond to treatment and how significant the lymphedema is at the start of treatment. Our program has a really strong focus on home self-management. We want our patients to be as independent as possible with managing their lymphedema at home and feel comfortable with managing it and not feel fear of exacerbating their problem after they're finished with therapy. And following formal treatment in clinic, then you'd be referred out to a wellness place to then get your custom garments. Typically, I like to see my patients again for one more visit after they are fitted for their custom garments to make sure that they are comfortable putting their garments on, taking them off, comfortable with wear schedule. Just make sure that there's nothing else that they have questions about or concerns, and that they're comfortable with their home exercise program with their new garments that they have. So we have a variety of different rehab locations that are able to treat this condition. There's a list here, and since this is being recorded, you can go back and access this list at any time. You also can access it through the Northside Rehab Services website. I'm going to hand it over to Tammy so she can talk a little bit about a wellness place, which is Northside's on-site garment fitting organization.
Hi, I work at a wellness place. We do have 3 different locations that you can visit. One in Atlanta at the Women's Center, one at Northside Hospital, Forsyth location. That's where I'm located, and one at the Cherokee location. But we have a wide variety of products that we do offer patients who have had a mastectomy and who has lymphedema or venous insufficiency, hypertrophic scarring. But we do offer post-surgical bras. We have mastectomy bras. We have the most wonderful fitters to fit mastectomy bras. We have the mastectomy pocketed camisoles. We have breast forms. Some are self-adhering to your chest and some are ready to wear. We also have prostheses for partial mastectomies and post-lumpectomies, and swimwear, swim forms, compression sleeves, gloves, and other recovery items. But as far as the compression side of it, we measure and fit patients anything from head to toe. We see a lot of facial lymphedema in the toes. We have, we can make custom made foot gloves, hand gloves, and then we have the over-the-counter compression garments. So we have quite a variety of things. We don't charge for patients visiting. We do require an appointment. We do require a prescription to come in to our office also. So we do have some questions for Megan, And the first question is, should a woman have acupuncture on the side of her mastectomy, especially if she had lymph nodes removed on that side? What are your thoughts on that?
Generally speaking, I recommend against anything that is going to puncture the skin, especially on the side where the lymph nodes are removed. We typically recommend to patients that they have shots done on the opposite side, anything that is going to puncture the skin. Just like a bug bite could lead to an infection, anytime you break that skin barrier, you are putting yourself at risk of infection.
Good. We have another question. Let's see. I wear compression stockings almost every day. Would it be beneficial to wear them to sleep at night, or at least the one leg that's most affected?
There are specific garments that are made for nighttime use. I don't want to give you just a blanket yes to that statement because it depends on the type of garment that you have or the type of compression sock that you have. Generally speaking, though, if you want to wear something overnight, I would recommend going to meet with the team at a wellness place to see if they can find you an appropriate nightwear garment.
Yeah, I'll also address, we have several different types of nighttime garments. You're talking about a compression stocking. What's most important is having the right compression. You don't want to use a therapeutic compression during the nighttime because it sometimes can act as a tourniquet when you're laying down. You would want capillary pressures around 25 millimeter mercury pressure, and you don't want anything above 25. But what would be more appropriate if you want to wear a compression garment, of course, it would need to be a gradient compression. 15 to 20 millimeter mercury compression would be more appropriate. TED stockings are around 15 to 20. So 15 to 20 would be appropriate. That's more of a prophylactic compression, but it's not going to actually treat lymphedema or venous insufficiency, but it's okay to wear at night. But we also have nighttime garments. Here's one, depending on the severity of the swelling. This is a nighttime garment. We have several different types. This one, it has chopped up foam inside. For the lymphedema patient, the chopped up foam is very beneficial for the patient in reducing the size of the extremity because of the high and low pressure. And it's designed so that the fluid is directed in a certain pattern away from the lymph nodes. So this is one type of a nighttime garment. We do have a variety of things, so you would have to talk with us about that. Let's see. Another question that we have, does having a higher number of lymph nodes removed increase your chances of getting lymphedema?
There is some theory that there may be a relationship. However, there's not really scientific evidence to support that you are necessarily at higher risk of developing lymphedema just because you had more lymph nodes removed. But if you think about the flow of your lymphatic system, you're putting yourself at higher risk of more traffic jam when you have less nodes to process the fluid. So I'm going to say not necessarily, but theoretically, it could.
Yes, that's good. I've seen a lot of patients that had absolutely no swelling for 20 years. They had 20 lymph nodes removed. All of a sudden, 20 years later, they started to swell. Usually they started doing something they shouldn't have done. Maybe they were picked by a rose bush and they got an infection and they automatically had lymphedema. The lymph fluid would pump down to that infection to guard against infection, and then had a problem with swelling. And then we've had patients with one lymph node removed and they've had lots of swelling. So it's interesting how you never know. Another question, is this therapy and treatment for lipedema the same as lymphedema?
There are similarities to the treatment, but the outcomes may be different just because of the physiological process that's going on between the two. But that's something that we would talk about on a case-by-case basis, depending on how the patient is presenting.
Right. Another question. Do you know of any options for someone who is trying to avoid having blood drawn in their affected arm, but has been told that veins in the other arm aren't easy to use? Do you know of any options for, it moved on me here. Do you know of any options for someone who is trying to avoid having blood drawn in their affected arm, and they have been told that the veins in the other arm aren't easy to use?
Honestly, your best bet is to be your own best advocate. I don't have any like secret magic trick for that, but making sure that you communicate effectively to that provider about the risks that you have if you are having blood drawn from that area. A lot of people don't really know a lot about lymphedema or the risks of it. And so it benefits you to be your own best advocate in educating those people as well to help spread knowledge about the importance of avoiding that skin puncture in that arm. Realistically, you may not always be able to avoid it, but doing the best you can to communicate that need and just say, I really need you to try on the other side would be my best advice.
Good. The next question, does a wellness place offer mail order options or someone who is not local? We do require a prescription when a patient comes in. We do require measurement. So we really need to measure the patient. A lot of patients order online for compression garments, and they can actually make things worse because a lot of times the garment is not a gradient compression. It's too tight at the top, constricting the blood flow and causing more swelling. So we do advise that the patient get remeasured once a year. But the prescription is good for a year. And if the doctor writes a larger quantity, you can do the mail order type thing. Once you're fitted, measured, you can reorder over the phone, and we can always mail it to you once we teach you how to put it on and explain how to take care of it. But we do like to check your measurements once a year to make sure everything's okay and that it is a gradient compression. We have another question. I have a kitten who likes to bite, nibbles on me. So far it is hard to control him. Is there anything I can use to protect my arm on the side of the mastectomy? Thanks.
I would recommend, until your kitten gets out of the biting, scratching phase, wear long sleeves when you're interacting with your kitten. You can wear gloves, something just to provide an additional barrier to the skin. Long sleeves aren't going to be perfect. I know they may still bite or tear through them, but giving yourself even just that little bit of extra layer can help protect you against those skin breaks.
Good. Another question. Are lymphedema treatments covered by Medicare, outpatient or OT and PT?
Yes. Any facility that takes Medicare, yes, your treatment should be covered.
The other question is, do they cover the sleeves or the compression garments? Medicare does not pay for compression garments, so you would have to pay out of pocket. However, if you are a Medicare patient and that's all you have, we do offer a large discount to take care of that. We give you 75% off in the cost of the garment, which makes it very affordable. And we don't charge for the office visit. We don't charge for the education. We don't charge for the measurement. And we like to set aside at least an hour, hour and a half to fit you with the compression garment. It's important that you know how to put it on and we explain how to take care of it. Another question, does insurance cover the cost of fitted garments by a wellness place? Insurance depends on the insurance. Some insurances do, some insurances don't. You could have Blue Cross Blue Shield, but there's many different types of Blue Cross Blue Shield. So we have to verify each time you come in. When you make the appointment, we would ask you your insurance information. We send it to a department to check your benefits, your compression benefits. So it just depends on the insurance. Here's another question. Is it better to exercise with or without the compression sleeve?
I would recommend exercising with the compression garment. Again, it kind of provides that wall that your muscle can pump against, so you get that better rebound to then pump that fluid through your system. That said, if you don't have your compression garment for whatever reason and you have the option to exercise, move. It helps to move your muscles and move your body. But ideally, yes, exercise with your compression.
Here's another question. I've been told that being in the pool water is very beneficial since water duplicates the effect of compression hose. Is that true?
Effectively, the water is creating a resistance, just like the wall of the compression would. The water creates a resistance for your limb so that, again, you get that muscle pump with some resistance to help encourage that flow. So yes, I would agree that water is great for helping.
One of the concepts that I was always taught, one of the men that invented the compression garments found that the only thing that controlled the fluid in his legs was to stand waist deep in water. And he did a lot of research on hydrostatic pressure, and he found that the further down he went in water, the tighter the pressure. So if he was standing waist deep in water, he would get about 40 millimeter mercury compression at the ankle, gradually decreasing up the leg. So that is true. Okay, here's another question. Is a doctor's prescription required for compression garments? If so, can I get even one, even if I'm several years post-treatment? Yes. Well, do you want to answer that? And I'll comment on it.
Yes, so you do need a physician prescription. And like Tammy said, because you need to be measured every year, unless I would say you should have an updated prescription. So even if your surgery was years and years ago, it's fine, but you need to see a physician to get that prescription before you come in. We don't necessarily want to see a prescription from 5 years ago because we want to make sure that your physician still agrees that that is an appropriate course of action for your needs.
Yeah, something else, the prescription is good for a year. And there has to be certain items on the prescription, such as a diagnosis code. We need to know the style. Is it a knee high, thigh high, arm sleeve, glove, gauntlet? And we need to know the compression. And keep in mind that 20 to 30 starts at a therapeutic compression. And we need to know the quantity. If there's not a quantity listed, you can only get one set. Here's another question. Is it still recommended to wear a compression garment when flying?
Not necessarily. So the theory that brought that about is that extreme change in pressure. But if you don't have swelling, it's not necessarily beneficial to prophylactically wear compression. Now, if you do have swelling and you have a garment already, sure, wear it while you're traveling, but it's not necessarily indicated. There's not necessarily science to support wearing a compression garment when you have no swelling just because you're flying.
Okay, another question. I have lymphedema and wear a sleeve and gauntlet. I walk a great deal, but sometimes get very hot in the summer. Is it okay? Or the overheating bad? So is it worth wearing the sleeve and glove when you're walking? Which is worse? The heat with the sleeve on, or should we go without? And
I would encourage you to exercise at cooler times of the day, such as early in the morning or later in the evening, so that you don't necessarily have to choose between one or the other.
Another thing on the compression side, there are different fabrics available. Some fabrics are more breathable than others. So you might want to talk to your fitter about the type of garment that you want to be fitted with. Some have 60% airspace, so it's going to be cooler than without. But imagine getting so hot that you're going to swell more when you're hotter. So it's not going to be of benefit going without a compression garment. So another question is, how do certain chemo treatments cause lymphedema?
So depending on what kind of medication is used, chemo treatments in general can be very hard on a lot of your body systems. Some of them can cause disruption to the lymphatic system, just in the way that the drug works in your body. It's hard on your body. It can damage the lymphatic system because it is aggressively fighting something in your body that is not supposed to be there.
Another question, if a patient had surgery on one side, what is the tendency of the lymphedema going in the other side? Can someone get lymphedema on the other side, whether it be the legs or the arms?
I have not personally seen that, but I don't want to say it's impossible. Typically, it occurs on the affected side.
Okay. Another question. I developed lymphedema in my right knee after surgery to remove a carcinoma. I now have to have a knee replacement on the same leg. Could the surgery trigger lymphedema?
Yes, it could. It's not guaranteed that it will, but having a history of it does increase the risk of potentially developing it again. So being aware of that and looking out for early signs of it and making sure you get in for lymphedema management as soon as you start to notice any signs would be of benefit.
Good. All right. Another question, do you know of any research that is being done to possibly stop the risk of developing lymphedema related to cancer treatment?
I don't personally know of any, but I have another lymphedema therapist here with me who looks like she might have an answer. Oh, there is a doctor in, where's he located now?
Yeah.
Mayo Clinic in Ohio. Okay, yeah, he's at the Mayo Clinic in Ohio. Dr. Chen is his name. He is doing some kind of new research about surgical management of lymphedema. Is he doing stuff for like risk reduction too, or is it primarily just management?
I think all of them.
Okay, so it sounds like he's doing some research on both risk reduction and on surgical management. So Dr. Chen might be worth looking into. I know he's got some published articles floating around the web. What's his first name, Jillian? Do you remember? I can send to Katie what his first and last name are, and I don't know if there's a way we can post his information so that if people are interested in looking more into him, they can.
Okay. Another question. I've just undergone surgery and don't have any signs of lymphedema yet. Are there exercises or stretches or any other measures I can take to avoid getting it? Would wearing a compression sleeve proactively be helpful?
I don't necessarily recommend wearing compression proactively. Similar to part of what that risk reduction process is, avoiding tight-fitting clothing, it can have a opposite effect if you don't already have swelling. There's not really anything you can do necessarily to prevent lymphedema. There are just the things you can do to reduce your risk. Exercise in general, like I said, is great. If you keep moving, your muscles are moving, they're keeping that fluid flowing. That is one of the best things you can do. Managing your weight, making sure you're eating healthy so that you don't have that fat cell releasing the chemicals that can damage the lymphatic system. Those are the two really big things, is keeping moving and managing your weight. But like I said, I wouldn't necessarily recommend compression prophylactically.
Okay, I'm going to comment on that also. At a wellness place, we do have compression garments for a lot of the nurses that stand on their feet all day. We have a 15 to 20 millimeter mercury compression starting at the ankle, gradually decreasing up the leg. A lot of, say, nurses, a lot of people that stand all day, they put a lot of stress in their venous system. And if they have a history, their family history of varicose veins or other issues intravenously, or even swelling, it's going to prevent further problems, but 15 to 20 is the minimum pressure. It's not a therapeutic pressure, but it's going to help to prevent varicose veins or whatever if they have that history. And then we do have a 15 to 20 compression sleeve that some people like to get if they are going to be on a plane or be very active, so there are some things available.
And I did get Dr. Chen's, just going back to the last question, first name, and I am adding it to the chat. It's Dr. Wei Chen, and he's actually at the Cleveland Clinic. So if anyone wants to look into him, his information is now in the chat box.
Okay, I have another question. I am 3 weeks post-op mastectomy and am still unable to completely stretch my right arm behind my back, but have full range of motion in my right arm. Are there any general range of motion exercises, movements I can do?
It depends on how your healing is. Really, that's something we want to address at a case-by-case basis. If you are having trouble reaching behind you, it would be a good opportunity to ask your physician for a referral. We would love to evaluate you here and see if there's anything specific that we can do to help you with that. There are a lot of movements that go into that one movement of reaching behind you. So, it could be that your external rotation is limited. It could be that your shoulder extension is limited, but until a therapist lays eyes on you and kind of sees what's going on with that joint, it's going to be hard to give you any kind of general exercise to help that.
Okay, good. Another question. Are there any first signs or symptoms that might indicate lymphedema prior to the obvious swelling?
Other things to look out for are pain or achiness in that arm or leg or whatever the limb is, face, torso. That heavy, like a heaviness feeling like the limb or the body part is heavier than it should be. Recurrent infections in that area could be a sign that you're having some difficulty processing that fluid. There was a slide that had some other signs and symptoms, but those are kind of the big ones outside of swelling, are pain, heaviness, and recurrent infections.
Okay, good. Let me see. I don't think we have any more questions, but I just wanted to show you, well, if there's a second, we have all different types of compression garments. It doesn't have to be ugly. It can be very pretty. You can get something bright and cheery if you like pink. We have some that look like tattoos. We have some where you can actually put some bling bling on. These are actually embedded with Swarovski crystals, and it can look just like your skin, and you can get any color that you want. But we're here to service you, and we want what makes you happy. If a certain color makes you happy, we'll take care of you. If you want to embed it in silver, we can do that. So let's see if there's any other questions.
We did have one question come in. Do you know, is restless leg syndrome and lymphedema at all related? Has there been any correlation between the two?
To my knowledge, there is no evidence to support that.
Okay. All right. Well, thank you, everybody, so much. We got such great questions in the chat box. Thank you, Megan and Tammy, for so much information. If you guys want any additional information on Northside Hospital Rehabilitation Services or what a wellness place has to offer, you can find it at northside.com. And a recording of today's program will be found on our website. So you can visit cscatlanta.org, and we have a videos tab where in probably about a week, you'll be able to find a recording of today's program, and you can find a lot of other great resources, previously recorded programs under that tab as well. So again, please visit Cancer Support Community Atlanta at cscatlanta.org. And before we wrap up, I want to give you Tammy and Megan a chance to share any kind of final thoughts with us. Tammy, I'll throw it out to you first.
Yes, I kind of covered some things. We have all types of compression garments, like I said, from head to toe. We have the breast prostheses and bras. It doesn't cost anything to come in to see what we have to offer. We do require a prescription, however, and we can address any issue to do with swelling, anything from head to toe. I brought some samples, but we won't really have time to go through all the different samples. I just brought them just in case, but it's amazing what is out there. And keep in mind though, compression garments are to contain the size of the extremity. So it is best to go through a lymphedema therapist to reduce if you do have the swelling. We do have some products to help to reduce. That would be some of our nighttime garments, and we also have Velcro wraps to help reduce. But it is very educational to go through the lymphedema therapist first.
So anything else, Tammy?
No?
Okay. Really the only other thing I have to say is if you think that you might be developing lymphedema, please talk to your doctor. Please come and see us. The lymphedema therapists here really love to help our patients get back to where they want to be, get to doing what they want to do, help fitting back in their clothes. We really love what we do here. And I know that the fitters feel the same way. So please, if you have any suspicion whatsoever that you are starting to develop it, talk to your doctor, come and see us. We would love to work with you. I've got one final slide here. Whoop. There we go. Thank you, everybody. Keep moving. Remember, lymph moves with movement.
Thank you. Thank you both. We got a lot of positive feedback in the chat box saying today's program was really informative. So thank you guys. All right. Well, everyone take care, and we hope to see you soon. Bye-bye.
Thank you, Katie.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.